We are an international nonprofit organization based out of DC, and we work with partners in countries and communities around the world. Our specific goal is to support partners' efforts, locally led efforts to address challenges related to corruption and the delivery of public services. So of course, when everything has been happening right now in India with COVID, I was like, this is exactly what we should be working on and talking about. Specifically, we believe in locally led learning and adaptive approaches to problem solving. So I'm coming into this conversation with a lot of questions, but not with a lot of answers. Experts here that I brought together from the fields of data science, economics, sociology, and of course, journalism are here to sort of talk a little bit about what's actually happening on the ground.
Each dot over here represents one life lost. And as we scroll down, so we start off early Feb, and we go all the way down to April, you can start to see that these dots, which represent actual people, are getting closer and closer together. It becomes much more dense. And that just is there to show that, the numbers are overwhelming. It is a frightening time. Until March 11th, the country was actually witnessing a downward trend in cases. However, political rallies, mass gatherings at festivals, more transmissible variants, and a slower than ideal vaccination rate have actually fanned the flames of a fire that was still smoldering and not yet extinguished.
The first wave of the COVID pandemic in 2020 actually exposed the loopholes in the public service delivery system, especially with respect to the social welfare. On top of it, the sort of challenges pertaining to vaccination, a lot of people are afraid of vaccination. A lot of people stay quite far away from the vaccination centers. A lot of people do not understand the importance of vaccination. The point is that how do we mobilize communities? How do we get the communities to become more empowered? How do we action youth from these communities, organize community-based organizations who can really action and really deliver the required support on the ground?
So then what do we do now? It's not clear. First of all, we know a lot more about transmission, so that should help us better target lockdowns. But then the new variants have been leaving a lot of us perplexed. So we don't know exactly how those things work. And we also know for sure that there should be advance announcements and there should be cash transfers or food transfers to the poor that accompany these things. That said, there is still almost certainly a need for a serious lockdown or a serious concern about focusing on saving lives. It's particularly frustrating in India that the leadership continues to be averse to criticism, and they sort of use the garb of anti-elitism to reject all criticism. So we hope that there's a change, just an openness to dialogue and criticism that can help us think about all of these considerations and design better lockdown policies for the next round.
It's a systemic failure. It is a governance failure. Let's just address the elephant in the room. Just 2 days ago, right in South Delhi, and I'm talking very humbly here, I am in one of the most poshest part of Delhi, South Delhi. Everybody knows that. And I just lost my relative 2 days ago because he was unable to find a bed in Delhi. That's the state of your healthcare system, my healthcare system.
Often as the open government community, we talk a big game. We really talk a lot about the value and importance of transparency and accountability. But I think this pandemic and what we are seeing sadly unfold in India and around the world is just how issues of transparency, accountability are actually matters of life and death. Where, India and South Africa were among the two countries that first approached the WTO last year to request for patents to be waived so that they can manufacture. Because at this rate, developing countries will inoculate their citizens in 5, 10, 20 years, and we actually don't have that kind of time to wait. And I think profits can be set aside.
In a democratic setup, these policies have to be demanded by the people. And one of the reasons why I say that it is also a societal failure is because we've all been sleeping over it, right? So we've all not been demanding enough from the government.
In a situation where the shared experience is mostly that of fear and distrust, we see so many situations where humanity comes together. And with the media objectively reporting on initiatives that exist to improve the situation, like food distribution services, community helpers, and more, I actually believe that we can grow the hope that we need to fight together through this.
Individual efforts are coming. In Delhi, people are supplying fundraisers. Everything, every resource is getting valued or it holds a lot of, weightage. So I think there's a systemic issue. Communities have come forward. What this crisis have also taught me personally is also, and when I see around my own initiatives with friends and all, is the collaborations that people have coming together. So when governance fails, definitely people have come together.